Good afternoon, Makua. I'm Dr. Robson, and I would like to discuss your diagnosis and your treatment options with you and your parents. Based on your x-ray and the description of your symptoms, it appears that you have slipped capital femoral epiphysis. This disorder is also known as SCFE. Your hip is a ball and socket joint, and there is a bone called the femoral head at the top of the femur. This will be depicted by my fist. This bone fits very tightly into a socket at your hip. When the ball is working correctly, it rotates whenever you move your leg. In cases of SCFE, the femoral head has slipped because the plate that connects the head to the femur has been fractured. Underlying causes for SCFE are unknown to doctors right now, but the condition was definitely aggravated by your football practice and by the fall that you took. Based on your x-ray, the femoral head has slipped pretty severely. Fortunately, there is a very successful treatment available. Unfortunately, this treatment involves surgery. The goal of surgery is not to put the bone back in place, but to keep the bone stable and to prevent hip impingement, which is the usual cause of arthritis later on in life. Dr. Durgan has suggested a hip replacement surgery, and while hip replacement is an option, it is usually not needed. Total hip replacement is only performed as a preventative measure to keep the injury from occurring again, and it is only considered for patients who are severely obese, have endocrine problems, or who have a low likelihood of follow-up. Instead of a hip replacement, the doctor can make a small incision in your upper thigh and place a metal screw through the femur, growth plate, and femoral head. A picture that can illustrate this procedure can be found on the next slide. This procedure has been very successful in the past, and patients generally leave the hospital within 1 to 2 days. Most patients have little to no complications. However, depending on the severity of the injury, results may vary. The more severe your slip is, the higher the likelihood of complications after surgery and later on in life. Because your slip is very severe, there is a chance that you will have a limited motion of your hip after the surgery, and the chances are greater of you having arthritis and other hip problems later on in adulthood. Until the surgery, you will have to be non-weight bearing, and the use of crutches or a wheelchair is necessary. After the surgery, you will need some physical therapy, and your orthopedist will have to track your development with periodic appointments until your skeletal growth is complete. This is to prevent further problems and injury. You will have to limit the amount of weight that you put on your hip by using crutches or a walker for 6 to 8 weeks. Any activity that will put unusual amounts of strain on your hip will not be allowed until the growth plate has reformed. This usually takes about 3 to 6 months. During rehabilitation, however, aerobic exercises such as swimming and biking are encouraged. I am very sorry to tell you that you will not be able to play football anymore. The stress that the sport puts on your body simply will not be enough for your hip to handle, and the chances of you re-injuring your hip are extremely high. Please feel free to contact me with any questions that you may have or any concerns. Please feel better.